Dr. Korch here. I miss you all, and there's nothing I'd rather be doing than seeing my patients right now. So I thought it would be a good idea to give you some guidance, especially with some braces if you're having some concerns or issues. I specifically want to talk about some poking wires or anything that might be rubbing that's uncomfortable. As an orthodontic patient myself, I had braces as an adult. I know there's nothing more uncomfortable than just that daily kind of irritating poking wire or poking brace. So disclaimer that everything that you have in your mouth is going to continue working. So a delay of a few days is not going to, or shouldn't say a few days, a delay of a few weeks is not going to hurt your orthodontic appliances. They will continue working. We do use long-acting temperature-sensitive wires, and even with the clear aligners, the appliances in your mouth will continue doing the job that we have instructed them or we have prescribed them to do. So reminder to always sanitize your hands, especially before you touch your mouth. I'm going to actually also put gloves on, so I will show you a few things that would be helpful to make it through some of these tough times with the braces and maybe some poking wires. So if you have some braces that are on your teeth in the front and not in the back, a lot of our younger patients have this. It's called a phase 1 treatment. Sometimes the wire in the back of the mouth gets a little bit pokey, and it is locked behind the teeth so that when you chew and you eat, the wire doesn't pop out. But sometimes that can come a little loose, or it can get a little bit shifted and it can start poking. So if you can use the wax that we provided for you, that's probably the best thing. We sometimes do get information that the wax doesn't stick well. Most important thing is to dry off the part of the brace that is irritating or rubbing you. So you can do that by just using a tissue, an old t-shirt, a soft washcloth, but it would probably be helpful for 2 people to do this. So one person to hold your cheek away from the brace, so when you dry it off, the cheek doesn't touch it then and moisten it again. You have to work quickly. So if you take the wax, you open up the wax that we gave you, they come in little strips. You all were given this when you had your braces placed. You also can buy replacement packs of these at any drugstore or any grocery store to get you through. And what you want to do is you just want to take a little pinch off of the piece of wax, and just very small, and you want to rub it between your fingers and make a little tiny ball. It gets a little soft also when you are manipulating it with your fingers. So you want to, like I mentioned, work quickly, dry off the part of the brace that is hurting or rubbing. You just want to take the little ball of wax, again, working quickly, and you want to push it, kind of really just squish it against the brace and then let go. So it should create a little cushion there that's like a Band-Aid. And then if your cheek touches it, it's not going to catch your cheek or hurt your cheek or your lips.